Now, what constitutes the anterior and inferior surface of the heart is largely dictated by the position of the interventricular septum. This septum bulges to the right, as the left ventricular wall is much thicker, about a centimetre, than the right ventricular wall, which is nearer 3 to 5 millimetres. The septum also lies somewhat obliquely across the heart, almost in the coronal plane, so that the anterior surface of the heart is about 2/3 right ventricle and 1/3 left ventricle. Whereas on the inferior or diaphragmatic surface of the heart, these proportions are reversed, so there's 2/3 left ventricle and 1/3 right ventricle. Now, the actual muscle of the four chambers of the heart and the four valves are all attached to and supported by a figure-of-8 shaped fibrous skeleton. This consists of a central fibrous body, and there are extensions called fila coronia, and these surround the valves. This skeleton actually divides and electrically separates the atria from the ventricles. It's a remnant of the atrioventricular cushions that form during the fetal development, and from it extending downwards is the thinner membranous part of the interventricular septum. Let's now look at the pericardium, which holds and protects the heart, but also provides enough potential space for filling and emptying of the chambers. The outer layer of the pericardium is the tough, fibrous pericardium, which blends with the adventition of the aorta, the pulmonary trunk, and the superior vena cava above, and the central tendon, the diaphragm, below. Within this fibrous pericardium there are two further layers of serous pericardium, a visceral layer lining the actual heart itself, and a parietal layer which lines the inner surface of the fibrous pericardium. These two layers of serous pericardium are continuous with each other as they reflect off the major vessels behind and also above the heart. Where they reflect between the pulmonary veins on the posterior surface or the base of the heart, the fold of pericardium is called the oblique sinus of the heart.